Good morning, Gilbert Elementary families and parents. I just want to get you up to speed on some new health office procedures so we are completely transparent as we move forward into a hybrid and then full in-person learning. This year, because of the pandemic, health office procedures will look different than from years past. I'm going to outline for you what will happen if a child goes home ill, tests positive for COVID, or is exposed to COVID. I want to be upfront and transparent so you know what to expect as we move forward to having students on campus. The minor issues will be dealt with more in the classroom to avoid cross-contamination with a potentially ill person in the health office. Please, and no matter what age, make sure that your child has a spare set of clothing in their backpack, as otherwise they will have to call home for clothes if needed. And this can happen as easily as falling in mud on the playground. We will be seeing more students sent home for minor symptoms. Per CDC guidelines, we have to err on the side of caution. As a rule of thumb, if you think your child needs medication such as Tylenol or a cold medication to get them through the day, it would be prudent to keep them at home rather potentially have them sent home from school. Per CDC guidelines, and depending on the situation, if your student is sent home ill, he or she may be required to stay home for 10 to 14 days. I'm going to repeat that again. It's really important. If your child is sent home from school, he or she may be required to be at home for 10 to 14 days. Your child can come back to school if you have a verification of a negative COVID test or a doctor's note that states your child has an infection other than COVID and is on an antibiotic to return to school. And if your child does need a COVID test, we were made aware that general pediatrician offices only have a couple on hand, and they typically use those for newborns for testing. So you'd be best going to one of those child urgent cares, CVS, Walgreens, that type of thing. If your child is exposed to COVID, please notify the health office to discuss safe return to school date and ask for testing resources if needed. Symptoms typically appear 2 to 14 days after exposure. If your child develops any of the following symptoms, please see your healthcare provider and or get tested. A cough, fever, chills, shortness of breath, or muscle pain. Emergency warning signs include trouble breathing, persistent pain or pressure in the chest, new confusion or inability to arouse, and bluish lips or face. If your child tests positive for COVID-19, please notify the school and state that there was a positive test. Someone will contact you to determine a safe return to school date. Your child will need to check in with the health office before being allowed to return to class. Or a parent may call and discuss with the health office staff the day before returning to school. Please know that when your child is sick at school, the health office will be calling you and you will have 30 minutes to pick up your child. It is for the health and well-being of your student and the entire school community that your students do not linger in the health office. It is important to update your child's medical history in Infinite Campus. If your child has seasonal allergies or suffers from migraines, for an example, it is important to make sure that that is noted on their annual update upon registration. We want this year to be safe and healthy as possible for all students and staff. Please adhere to the procedures in place so we have a safe environment for all students. Thank you, and please feel free to contact our health office at any time if you have any further questions. Thank you.